And then a study came out in 2015 or 16 and that showed that less than 3% of couples could afford fertility treatments. And when I read that, I felt kind of sick, cried a little bit, and I was just like, I have left in the last 25 years so many women in the dirt. And so I was like, how can we democratize access to women's health starting with infertility? It never occurred to me that you could use technology to do this, but we built a first version of an app that was designed to be a digital twin of me. So everything that I would do, because when we talk about acupuncture, acupuncture is one of the tools that an acupuncturist uses, but an acupuncturist is actually a doctor of Chinese medicine. So they should have a bunch of tools in their toolkit, things that, diet, lifestyle, behavioral health, those kinds of things. So we built, a first version of this with the goal of like, could we build a piece of software that would be 50% as effective is the real deal, is going to acupuncture and the whole experience, the human interaction, all of that. And then the shocking results were that actually the AI was better than me. And that was the point in which I sold my clinics. Then the rest of that time in between, we go back to living our lives in the same way. And what we're able to identify is literally 80% of what's going on with women's health across the whole reproductive life cycle can be tied back to epigenetic factors like modifiable diet, lifestyle, behavioral health factors. So now
Got
we
it.
just expanded it just one more part. So then just what we expanded is instead of just having Kai, you have a whole virtual care team. Therapist, chef, nutritionist, data scientist, tongue analyzer, acupuncturist, and you can interact with each of those care teams for whatever you need every single day, all day long for, almost nothing, $15 a month. And so unfortunately, currently in health, the AI is so much better than the human experience. Typically, for OB-GYNs and family practice physicians, they're elated. If my patient could have all of this help every single day, it will really help them to improve their health. And especially for fertility, what's nice is that when people want to get pregnant, they're very disciplined. They have a kind of discipline that no other patient will have because the carrot is very strong. And so if you just break it down and you make it so easy for them, they will do it.
There's so much opportunity to fill those gaps, regardless of what kind of care needs people have. That being that 24/7 helper that can provide the support and the empathy and the understanding and the clinical expertise when it's called for, right?